Morning Show.
All right, Rickey Smiley Morning Show. Hey, every Wednesday is Wellness Wednesday. We got the one and only Dr MJ Collier back with an update on the hot topic, that's going on in medical news. Dr. Collier, good morning. Happy to have you.
Good morning, Rickey Smiley, and thank you so much for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. Listen, good morning, Rock T, Special K, Maria, Gary with the T, and the Brat. So listen, Rickey, there's some major things going on in the House of Medicine right now that I want to share with the listeners of the Rickey Smiley Morning Show. So if you suffer from an autoimmune disease such as a lupus or an inflammatory disease in your organs like ulcerative colitis, organ transplants even, or if you have any type of cancer almost, there's a new class of drugs called biologics. These have revolutionized the therapy, and it's a new form of treatment that you're going to have to ask for because it's so expensive. The National Cancer Institute defines a biologic drug as a substance made from living organisms or its products that is used in the prevention, diagnosis, or treatment of cancer and other diseases. So, Rickey, this is the age of immunologic therapy. You know the usual method of treating cancer focuses on eliminating the tumor through either surgery, radiation, or classical chemotherapy. Unfortunately, such treatments often do substantial collateral damage to healthy tissues. Your organs get damaged. This leaves patients with long-term side effects such as infertility, for women, premature menopause, often weight gain, painful neuropathies in your arms and your hands hurt, heart disease even. People they're now predisposed to heart attacks and strokes, or even a secondary malignancy. I've had patients that were treated for one type of cancer that may have been eliminated, and then they come up with another type of cancer within a year or so. And so that's due to the traditional therapies. Now, biological therapies free the patient from the traditional side effects of cancer therapy and an increased chance of long-term control or even cure. Diseases that offer biological treatments often include multiple types of cancers like stomach cancer, gastric cancer, lung cancer, bladder cancers, head and neck, skin cancers, breast and prostate cancer, skin cancers such as melanoma or squamous cell carcinoma, and colon cancer. So all of these are new and amazingly effective therapies. They are smart bombs that basically destroy the cancer cells and don't do any collateral damage. Skin diseases like psoriasis, this is really a big problem for a lot of people, and these drugs can take care of it. Crohn's disease, and we talked about ulcerative colitis. And so these are things that you need to talk to your doctors about. Make sure that they're making them available to you as one of your treatment options if you have one of those disease states. It's thought, Rickey, that these drugs can cost up to $250,000. So that's why you're not hearing a lot about them. But they are so effective. They are really what we have been looking for in the treatment of these disease states. But right now, it's just financially challenging for somebody to pay for it. So that's the problem.
All right, let's go to the phone. Join with Dr. Collier. Good morning.
Good morning. This is Ashley from Altamont. Yes, I was just wondering about sex during pregnancy. It's concerning. Just want to see from a medical perspective what you all have to say concerning that.
Okay, very good, Ashley. Thank you so much. Sex during pregnancy is often recommended, and it's a good way to relax for a woman, particularly as you get toward the latter portions of the pregnancy. It can be uncomfortable. You might have to be conscientious about positioning. Laying on your side is very comfortable, and possibly, standing and bending, those sorts of things. Position is very important, but it's pleasurable. Orgasm is very good for the pregnancy and helps you relax and just feel better about the pregnancy. It's such a challenging status because, you're feeling bloated, you're feeling full, you got all that extra weight that you're carrying on in your stomach, so it feels like a weight is on your bladder. So sexual intercourse is highly recommended and a good form of therapy during pregnancy.
All right, John with Dr. Collier. Good morning.
Good morning. This is Anna, and I'm calling from Greenville, South Carolina. I was wanting to know if you feel like fibromyalgia and bipolar disorder correlate in their symptoms, and if so, how you combat the symptoms like brain fog.
Those symptoms are, again, all of them, I think, are due to inflammation in the body, and so you treat it with anti-inflammatories. Natural anti-inflammatories are very good. Of course, vitamin D is the body's natural anti-inflammatory, and then things like curcumin, other things that you can make teas from, or you can take capsules from. All of these things will relieve that symptomatology, and even now they're looking at immunologic therapy that I just discussed for the treatment of that disease state. So stay tuned. You're going to hear more about it. But again, the problem is inflammation. And so I would recommend as casual supplements, vitamin D and omega-3 fish oils.
All right, y'all with Dr. Collier. Good morning.
Good morning, Dr. Collier. My name is Mr. Bill Cargill. I'm calling from Cleveland, Ohio. I'm a truck driver. I had to take a DOT physical yesterday, and they told me I had blood in my urine. Tell me, what do that come from?
Okay, blood in the urine is a common thing, particularly in truck drivers, because literally those seats are constantly going up and down and shaking your kidneys up. For most people, it's a condition called benign hematuria. That means blood in the urine. It doesn't mean anything of substance or significance. Now, you measure this on a scale of 0 to 4. If it was 0 to 1 plus, I'd just recheck it again in a few months. If it was 2 plus or greater, then you might need to be checked for anything from a urinary tract infection or to prostatitis. So I would not necessarily ignore it, but it's very common in my truck driver patients, and something that, again, if it's 0 to 1 plus, I don't really worry about. I just monitor. So benign hematuria is more than likely your diagnosis state. But if you have any other symptoms, such as burning when you urinate, difficulty passing your urine, getting up more than once, or if your urine actually appears to be bloody, then you need to have it evaluated by your primary care doctor or your urologist.
Oh, wow. That's good stuff right there. Dr. Collier, let everybody know how you can be reached.
Okay, Rick, I can be reached on all social media at AskASK Dr MJ. I just want to let everybody know about that this Saturday, September the 9th, in conjunction with the Sideman Keeping It Positive Foundation and the Atlanta Medical Association, we're having a big health fair at the Mall West End from 10 a.m. until 2 p.m. We'll be providing over $2,000 worth of symptomatic tests for these patients, evaluating you from head to toe. We got eye doctors evaluating your eyes, podiatrists evaluating your feet, chiropractors evaluating your musculoskeletal system, and doctors of every specialty coming to you at absolutely no cost. So come out to the Mall West End this Saturday at 10 a.m. These are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Ricky, one more thing.
Yes, sir.
Hey, don't you dare go away. You moving and grooving with Dr. MJ on the Rickey Smiley Morning Show.